For the past several years, doctors across the country have been helping patients remove fat with a fairly new liposuction procedure called SmartLipo.
In Grand Rapids, Dr. Scott Carlson of Carlson Laser Aesthetics performs the laser-assisted procedure. He is here with us today with one of his patients, Carrie Bradstreet. Now, Carrie just had the procedure done, but we first want to talk to Dr. Carlson. Can you just explain what SmartLipo is? Because there are a lot of, it seems, similar procedures today.
Well, liposuction has had a long history, and the current procedure is SmartLipo. It's basically a laser that is used. There's two light beams in the laser, two frequencies, and one melts the fat very nicely and slowly, and the other one helps stimulate collagen so the skin gets tightened up.
And what's the advantage of doing it that way?
Well, the advantage is the laser beam is carried through a small quartz fiber, and it's really small. It's like 1.8 millimeters. So when we make an incision, we're just making a tiny 2 to 3 millimeter incision. We use a cannula to get the quartz light laser beam in there, and we can just go ahead and laser for the whole area, let's say an abdomen. And then when we're all done, we're able to go in there and suction that melted fat out of there, again with a very small catheter, no more than 3 millimeters. So, so the incision is very small. It's non-traumatic. For the most part, tolerated very well for the patient. And the best part, we can do people on Friday and they're ready to go back to work on Monday or sooner in some cases.
Okay, Carrie, you're here today. It's kind of confession time. You had this procedure done on Friday. Tell us a little bit about what you experienced and then what you did on Friday night.
Oh, well, the experience was that I showed up at your office about, my appointment I think was like at 2, and it was basically the worst part was I think just numbing the areas, and by the time we got done around 6, I head home, I changed my clothes, and then I had to be to Laugh Fest to host a segment. So nobody knew I did
no
this.
Downtime.
Wow. No downtime.
That is just incredible. And you know, Carrie, you're a slim woman. You're in really great shape. Why SmartLipo for you? What made it
said
something?
Smart in the and so I
You said that's me.
That's me.
That's
I'm
me.
smart.
I'm smart. Yeah.
But you know what? Actually, I am fearful of needles. I couldn't watch this procedure on somebody else. But I've had areas, I told doctors since I was 16, I've had trouble areas that just would not go away. And the older I get, the harder it is to even get rid of anything, let alone the stuff that's been there for 30 years. So I figured, you know, what the heck? We'll give it a try. I have nothing to lose except for, like, fat.
You know what? Yeah, there's no downside when you have nothing to lose but fat, right?
Yeah. So, Dr. Carlson, maybe you can speak to that a little bit more. I mean, as much as some people like Carrie try to work out, and I know it's really hard to pinpoint those trouble spots, and sometimes it's just almost impossible without a procedure.
Well, that's why Carrie was a perfect case for today's demonstration. Is a lot of women work out and struggle with this, especially women after childbearing. They have a hard time of one area or another that upsets them, or is a focus to them that is very distressing. Either it's their stomach or a little saddlebag area, and Carrie just had a little area around the knee, a little bit on the inner thigh, and a little bit on the outer thigh, and she's worked, as you can tell, worked very hard to stay in shape. So this is a perfect procedure for just contouring the body.
And we know you're still kind of recovering from your procedure, but we do have some before and afters of other patients. And Dr. Carlson, these are just incredible. Tell us about them.
Well, that's inner thigh, and as you can see, we took down quite a lot of fat out of the inner thigh in this lady here, and you can see just the thighs don't touch as much in the middle. Here's an abdomen. This is a lady who was in her 50s. She had quite a loose and a little bit of fatty layer there in the abdomen, and look at that. That's bikini style abdomen for a 50-year-old.
That's changing your waist size dramatically.
She looks younger.
She does. So it looks like a 25-year-old's abdomen.
And a lot of people don't always think about that area, the chin, and when we age, that just tends to sag a little bit more.
You can see we took and straightened out her contour of her chin a bit and tightened up the skin, and very happy. That lady is a drug representative, and I think she's very happy with her findings.
So, Carrie, your recommendation to people, if they're interested, come in for a consultation. I'm imagining you started out by talking to the staff at Carlson Laser Aesthetics just to get an idea of really if you were a candidate for this procedure.
Well, I went to your open house, and then they had a representative there, and I kind of listened in, and I thought, you know what, if I could just find out how much it is. And I joked with the doctor. I said, well, I've got some old gold jewelry I could sell. And you know what, I did. And I had enough to pretty much pay for this, so I didn't have the guilt of spending the money on it. And I thought, well, I found the money, so what the heck. So,
That's wonderful, and I know that, you look fabulous.
Oh, thank you.
You're a beautiful woman, and your job takes you in the spotlight too. So what confidence you have in being able to go out and feel your very
best. Don't have to think about that area anymore. It's just
absolutely.
off of my mind. So,
That's really great.
Okay, and you have a special actually for 8 West viewers that called today.
Yes.
They can actually come in. If you purchase a SmartLipo, you're going to get a free laser hair removal in certain areas like the bikini line, upper lip, underarms, and the chin.
One of those areas.
One of those areas. Well, that's fantastic. I did laser hair removal on my underarms. It was really a nice procedure. And again, your staff just makes it so easy to come in and get those questions answered, because you really have to develop that trusting relationship with the staff and with the doctor.
That's what it's about.
Yeah, conveniently located on the East Belt line. Remember, you have to call today to get in on that deal.
Absolutely.
So thank you for coming in today.
Very good. Thank you.
We appreciate it.
We appreciate it too.
We'll be right back.
Are you West?